question number 2. What do you think about sealants, and are there particular materials to watch out for that are toxic? And Laura says, my 9-year-old son has super deep crevices in his molars. The dentist is recommending sealants because he already has some soft spots, and they said his teeth will be more prone to cavities. Is this a healthy and safe choice, or is there a better option?
So the first question is the concern with material. So yeah. I just outlined some of the traditional materials and procedures used that we go to a lot of effort and great lengths to counsel patients through decisions and what to do and how to address. So it makes sense that if we're going to use any material or replace a toxic material with something, that it should be compatible, because these are they're implanted in your body. Once they're there, you can't do anything about it unless they're undone again. So I think it is worth it's worth really putting a lot of effort into choosing materials that are healthy.
Yeah.
And there's ways we can do that. I mean, most of the materials now, primarily you try to stick with ceramics, and that's where most ceramics and resins. So with sealants, I think sealants are good. To me, it's real case specific. If you take a kiddo or a young adult, mostly kiddos, the theory behind them is you seal up these vulnerable areas during the vulnerable times, say when a kiddo's not taking care of their teeth. I mean, that's kind of the idea. And it gets them through these times of their life where these little vulnerable areas can turn into problems. And then the idea is if they get into adulthood, then they start taking care of things and need sealants.
Yeah.
And there's a whole lot more to it than that. But if a kiddo comes in and their diet's good, they don't have vulnerable areas, sometimes teeth, it's the little pit and fissures, the crevices in the tops of the teeth.
Right.
That's mostly what sealants address. Well, primarily what sealants address are the chewing surfaces of the teeth. And there are times where you don't get complete closure of those lobes of the teeth, and you have vulnerable areas that are microscopic, and they can be vulnerable even in kids' mouths that take care of things. I mean, they're well nourished. Okay. They take good care. They brush their teeth, and they still can develop decay because of just the vulnerable areas. And those are the kiddos that I would recommend doing sealants on. Or you discuss it again, pros and cons.
Yes.
If it's a kiddo who may not have a lot of vulnerable areas, but they have awful home care, awful dietary habits, well, you still might consider them. But then the vast majority of people don't have a lot of vulnerability, and they're pretty good about taking care. And so, I mean, those I actually won't recommend it, because the cons of sealants, I've only had one cavity in my life, and it was under a sealant. That my dad did. He did a good one with a good material.
Right.
But over time, the concern is they lose their bond and seal 20 years later.
Yeah.
And what ended up happening with me is it leaked under that sealant, and you don't really know that's going on until the sealant pops out. Fortunately, caught it early. It was a minor problem. But and the other thing is, I mean, if let's say you take a vulnerable kiddo who has poor home care, and again, their diet's poor, and all the other factors that lead to decay, sealants help, but that's certainly not fixing the problem.
Yeah.
The problem then is, what do we need to address to keep this wildfire from happening in this child's mouth that can prevent there being the need for more dentistry and this dental snowball accumulating for the rest of their life. So I'm okay with sealants. To me, again, they're case specific. I look in the kid's mouth. We look at the history. I mean, if there's a young person that's 12 and has no sign of decay, got all their permanent teeth, and it looks like there's a chance that they can make it through these next formative years with no problems, we watch and we, again, don't intervene. And then the materials, the concern with some of the resins are, again, some of the makeup of the resins. BPA is a big one. I think that's a big one with a lot of sealants. And unfortunately, in a lot of resins, dental polymers, BPA was in a lot of the early resins. They've gotten better about taking it out.
Okay.
And so the runnier the resin, the more BPA typically, which is why sealants have more of it than, let's say, composites, because composites are more firm because of the way we have to place them. But there are non-BPA, and there's actually even new kind of chemistries for fillings that get away from BPA in whole.
Oh,
So
wow.
you can still, place sealants if they're necessary, and it's determined that it's necessary and the parents are on board. It's good to prevent a small problem before it gets into a big problem. We use a lot of ozone in our practice, and there's a lot of protocols incorporating ozone with sealants and sterilizing before you place them. And I actually, the sealants we place are actually more like little conservative mini fillings. We use the same technique as we would in our fillings, just way conservative versus a sealant material, which I don't think actually is really it's the sealants are pretty vulnerable to breakage and wear and bonding.
Yeah. Well, and then after reading the root canal book, which I highly recommend everyone read, by George Mining, he was saying that in the root canals, you've got bacteria that's basically getting in and around these root canals. And I was kind of wondering, maybe with these sealants, you've got the same type of issue with, like you had when you were younger, with bacteria getting in and around it.
Yeah, well, and this may be, I think this may come up later in a question, but I think the whole idea of why tooth decay develops is changing, and it should.
Yeah.
We have a very mechanical view that you eat the wrong things and don't brush and cavities happen, but there's a lot more nuance and complexity to this system. And so, sealants, I mean, so to your point, and it's a little different. I mean, yeah, you can get leakage around the sealants and still catch a problem. Let's say a kiddo does have a sealant, and it helps them till they're in their 30s, and if the sealant falls out and they have a little cavity, well, you address it then, versus maybe that being a bigger problem had the sealant not been done. But that's a different kind of leakage. That's a traditional progression of a cavity, more than like a root canal is kind of a different process, but the same idea that.
Yeah. Okay. Well, good. Well, that's so it really is an individualized decision, and kind of look at the person's history and background, what their diet and lifestyle and everything is like, and then of course use the non-toxic materials.
Well, and just like in any other place in medicine and healthcare in general, there rarely is there a one size fits all approach.
Right.
Because
Yeah.
we're very, I mean, people, they're different. And I mean, there's different thresholds and different situations. And sealants, unfortunately, are kind of one size fits all. And a lot of it kind of is insurance driven. You go into an office and your insurance covers it, so the kid gets sealants, whether they need them or not. Or maybe the dentist believes in them more, and that's fine. I mean, they're using their clinical experience, but to me, it needs to be a little more individual than that.
Than just well, good.